organism for the veterinarian services in Mexico that are making us the favor, first of all, of supporting us this morning, but also for being related to the activities related to this infestation. And also to thank the participation of the ORISA, the USA, the FECALAP, who are supporting us in this very important task, the FECALAC. I would like to tell you a little bit what is the AMLAC, the Mexican Association of Milk Producers. We represent producers all throughout the national territory. We have 4 years of having appeared with this new denomination, but nevertheless, we have our background in the National Dairy Production Company that has been an organization that has existed for 43 years. We are a transition organism derived from a federal restructuring that took place. The finality that we have is to promote the sustainable development of milk production and profitable milk production, or the dairy production, and to be the leader, an important leader in the instances of the private sector related to the activities that are carried out. Well, this morning, as I said, it is very important for us to have a topic, deal with a topic that is definitely something that is that is very important at this moment and is affecting the region, and that it is having a lot of relevance to know what is being done to keep a control on the situation. To begin with this program of activities, I would like to give the floor to our president, Alberto Valdez, so that he can give us a welcoming message. So, Alberto Valdez, please. Well, good morning to all of you. Like always, to thank the ICA for the webinar, the participation of the SICA, the UNDA, ORISA, and FECALAC. I think that this is a very important topic. As we mentioned before, there are situations or things that do not respect the borders or territories, and I think that we have to try to improve these relationships and this communications between us. And I also thank Calderon for being here with us, and for him to know that he can count on us to be attentive and to support him in whatever he needs. Welcome all of you, and I hope that this is something that is very useful to all of you. And as we always said, an informed producer and a producer that is trained is a producer that has a future. Thank you very much. Thank you very much, Beto. Thanks to all. Here we are greeting you from the ICA platform. It is a pleasure for me to present to you also Wilmer Fernandez, who is the president of the Central American Federation of the Dairy Production Sector, FECALAC for its acronym in English. And also, as the friend Valdez was saying, good morning to all of you. Welcome. Welcome to this event in which we will talk about the situation of the screwworm in the region and advancement in the prevention, control, and eradication. But for this, I think that it is important also the surveillance of our livestock in the production unit. The report to the competent authorities, as well as to be informed of the control and eradication. And that's what we will be dealing with in this meeting, this day. That is why, on behalf of the FECALAC, the Central American Federation for the Dairy Production, just like Beto said, we would like to thank ORISA that in its 71 years of service, this is another additional service that they are providing, and to the ICA, and especially to Alejandra, who has been our ally all throughout this process, especially in the construction of tools and the putting together of tools to be able to regulate the process for the production within the region. The OPTA, which is the Federation of Agriculture, we appreciate send our appreciation to all those who are connected and those who will make their presentation today, Dr. Valerdo de Gracia, Armando Garcia, and to you, Alejandra, and finally to Octavio, who will be illustrating us by giving the conclusions at the end of this webinar. Welcome all of you, and on behalf of the FECALAC, where we have the coming together of all the primary industrial sectors of the Central American region, well, we would like to thank you once again for this opportunity. Thank you.
Muchísimas gracias, Wilmer, por este importante mensaje. Ahora quisiera darle la palabra.
Thank you very much, Wilmer, for this important message. Now I would like to give the floor to Jose Ordaz, the manager of the AHSF program of the ICA. Thank you very much, Octavio. Thank you very much to all of you. I am Jose Ordaz, the manager of the livestock safety, and the agro-quality of the ICA. As a career, I am a veterinary epidemiologist and specialized in the dairy production. So I'm very keen to the topic that we're going to talk about today. For me, it is a pleasure to be here, giving you the welcoming to this very important webinar regarding the situation, the current situation of the screwworm in the region, and to know the advancements that we have in its prevention, control, and eradication. I would like to, first of all, thank the Mexican Association of Dairy Producers, AMLAC, FECALAC, for opening this space so that we can get to know more about the screwworm and recognizing the great job of the presenters that are going to be talking to us today, Dr. Abelardo Desgate and his Orisa team, in the efforts of the contention, control, and the eradication of the infestation in Central America, as well as Dr. Armando Garcia, Director of the CPA in Seneca, for sharing his knowledge in the topic, as well as the contributions and the jobs for the screwworm in the Central American countries. I would like to also acknowledge and give a very warm greeting to the Director and Head, Fernando who was here to recognize Diego and Rocio Campuzano, as well as the collaborative job that we do with the USDA. Sorry. And finally, I would like to appreciate the work of our specialist analyst of the engineer Alejandra Diaz, for leading the efforts for the prevention and the control of the screwworm in the topics of management and communication of risks. As you will see today, the actions are focused on strengthening the detection measures and prevention, control, and eradication of the screwworm. ICA, OIRSA, USDA, and all the official authorities of the different countries in Mesoamerica are seeking at every cost to eliminate the devastating effects of this plague. But it is very important to have the knowledge. We have to know and be informed to be able to reach the objective. And how do we do this? We do this through an adequate communication of the risks of this pest and knowing at the moments of detection and treatment, so that we can avoid devastating consequences in our livestock industry, in our pets, and in our people. This is a job that is done by everybody, all the way from the physician to the family doctor and to the hospital centers. We all have to know, recognize, and acknowledge and report this threat. And remember, time is gold. And as we say, we have to stop this pest as soon as possible and contain it. And together, we're going to be able to do it. And if we do it, we will be able to do it more. With this, Octavio, thank you very much and for giving me the opportunity of opening up this very important webinar. Thanks to you. It is also a pleasure for me to give the floor to Abelardo, who is also with us again, who is also with us now. Abelardo. Hello, good morning to all of you. Can you hear me?
Hola.
Sí.
Sí, adelante, Abelardo.
Es que tenía unos problemitas.
Yes, I was having some technical problems with the sound, but it seems that I was able to fix it.
Bueno, de verdad que es un gusto.
Well, it's really a pleasure. I really thank
La invitación a
all of you for the invitation to the OIRSA. And Jose and Alejandro, I've already said it, we are working together. There I see many people that I know. I greet you all. I'm not going to mention each one of you by name, because if not, I would be spending too much time doing it. But we are here hand in hand so that we can work together. For the control and the contention of this illness that is affecting the Central American at this moment, the three countries, and that we hope we can contain it so that it doesn't continue on going north. So it is a good time to do this activity. Thank you, Jose and Alejandra, for this constant communication and job that we are precisely carrying out between OIRSA and ICA, which is something very well coordinated, and also with some other institutions like the FAO, APHIS. Well, we are at your service, and pretty soon I will be back on the screen talking about this topic that is bringing us together. Thank you very much.
Gracias, doctor. De gracia, muy amable.
Thank you, doctor.
Quisiéramos darle la palabra también
We would like to give the floor also
a las personas que nos acompañan de APHIS. Alejandra, si eres tan amable.
From APHIS. Alejandra, if you are kind enough to present it, please.
Gracias.
Thank you, Octavio. They still have not joined the meeting, so please let's continue.
Gracias, muy amable. Pues para dar por
Well,
concluida esta fase
to
de
conclude this opening
quisiéramos
phase,
pedirle un mensaje al
I would
ingeniero
like to ask for a message from Engineer Francisco Javier Caldonia de Salde, who is the General Director of the Food Safety and Agricultural Quality of the Secretariat of Agriculture of Mexico, who is going to give us a welcoming message and to request also, if it is possible, to declare and inaugurate the job for the day. Thank you very much, Javier, for being with us.
Gracias. Buenos días. Gracias,
thank you very
Octavio.
much. Thank you. I kindly send my regards to Alberto, to Mr. Wilber Hernandez, Jose Ordaz, the specialist that is accompanying us, Abelardo, the engineer Alejandra Diaz, here from Senacica. The Ministry of Agriculture of Mexico, as you know, is something that has great importance. This is a topic that has a great importance. This began in 1972, and this country, along with others, began a very important campaign to eradicate the screwworm from this country. It took us 31 years to finally be able to do so. In 2003, we declared ourselves free of this very important pest in Mexico. Today, this is once again a topic that is on discussion on the table and very important to our country, because once again there's a threat affecting the cattle producers of our country, and that is why for us it makes us feel very warm and happy to have all these people to be participants of these initiatives and the government, because their actions, the information that they might know, the communication that we may have is of vital importance. That is why I congratulate you for the commitment that you are demonstrating through actions such as these to try to maintain this infestation out of Mexico, Guatemala, and Honduras, El Salvador, and Belize, but also the efforts that very jointly are being done by the regional environment that's eliminated from Nicaragua, Costa Rica, and Panama. As you know, Mexico, last July the 19th, activated the national emergency device for the first time in the history of this country. This device is activated with a preventive mindset and not at the moment of having a plague already in our country. This device, apart from mobilizing financial resources, it also mobilizes all the technical support of the Senacica. And with this, we are protecting our livestock in the country. There are 23 million heads of cattle, 1 million heads of cattle that we export to third countries, to the United States, but also that we protect the human health is something that is very important. The technicians of Senacica to this day are already looking preventively the 7 states of the Republic, the farms, the possible places where we would be expecting to have the introduction of this problem of the screwworm. But I would like to point out that it is part of these training campaigns. I want to express that Mexico, just like at this moment we are free of the screwworm, our actions are focused on the prevention to the early detection of a possible arrival of this problem, because this represents the greater possibilities of being able to eradicate it once again. This strategy of Mexico is a national strategy, and it is trying to articulate itself better with the national entities. We cooperate with our brother countries of Central America, offering the quick diagnostic, providing technical support and providing them some necessary input for the detection and the healing of the cattle. And I would like, therefore, without further ado, to thank for this initiative. As we said, this is an important part for the dissemination of the risk that there is. And in this sense, I would like to formally declare initiated these jobs of dissemination of information being 9:20 of this morning, September the 12th of the year 2024, hoping that the results coming out from this meeting will be very productive for all of us. Thank you very much.
Muchísimas gracias, Javier, por este
Thank you very much, Javier, for this very important message on behalf of the Seneca. As you mentioned it is a topic, a key issue, especially because we have had a prior experience already, and undoubtedly, the knowledge of the technicians of the Seneca are going to contribute to avoid or to reduce any possibility of infestation of this affectation. And I was begin with the program. Please, any questions or doubts you might have, please write them down on the chat so that we can analyze them, and we can therefore pass it on to our presenters when we come to the Q&A session. Well, to begin with this, I would like to now give the floor to Dr. Abelardo de Gracia. Give me a second here, please.
Perdón, al doctor Abelardo
de Gracia, who is going to talk to us about the situation of the screwworm in Central America and the containment measures. Dr. de Gracia is a veterinary physician. He has a master's in experimental epidemiology applied in zoonosis by the University of Sao Paulo. He also has studied in epidemiology and economics in Germany and epidemiology and analysis of risk from the State University of Colorado. He is a professional with broad experience in epidemiology and zoonosis. He has held different charges working in pro of the human health in his native Panama, and he has a great territory in the area. Currently, he is the regional director of health security of the area. So, without further ado, Dr. de Gracia, the floor is yours. Thank you very much, Octavio. I would request Alejandra, are you going to do the projection or should I do it myself here? Maybe it's better for you to do it. And if you have any problems, we will try to help you. Let me see where I can share a screen. Okay, right there. Perfect. Give me a second.
¿Se ve?
Sí, está todo muy bien.
Yes.
Okay, déjeme ponerla en...
Let me put it in presentation mode.
¿Todo bien?
Okay. Everything okay?
Gracias.
Perfect. Thank you.
Okay, bueno, buenos días a todos nuevamente.
Well, good morning to all of you once again. It is a pleasure to be here and to be able to see that we can all work together, agencies, governments, official services of the state and public sector, in which we at ORISA believe that the union, a public-private sector, is the most important way of being able to control and manage and advance in the areas of animal health in the production systems. Without further ado, I'm going to give you an idea of the current situation of the screwworm, cattle screwworm. And then now with the screwworm, we are joining our efforts so that we can advance quicker in the advancement of control of the illness. Let me show you the situation in Central America. This is a chart to week 35, the epidemiological week 35. The year is divided into weeks, and each week we give a number. This week's 35 corresponds to the week.
Ya al final de esta semana,
the late week. At the end of this week, we would have the data of the next week, which would be the week 36. So it is a photograph of the situation of what is happening in each one of the countries as close as possible. As you can see, in Nicaragua, we have the number of new cases of 199, and the cases accumulated, and how many accusations we have. This allows us to see the degree of advancement and effectiveness of the veterinary service. The next column is the percentage of species that are affected. As you can see in the three countries, the most affected species is the bovine in the case of Nicaragua. The second species that is most affected is the swine or the pork. Different to what happened in Costa Rica and Canada, the most affected species are the canines. The second variable in Nicaragua is because approximately 80% of the exploitation is of backyard hogs, and the way they have them tied with ropes or something, it causes an injury in the neck of the animals, and they are more due to having injuries in which the worm skin, the screwworm skin come in. And that's why we see this also happening, and that's why it happens more with the porcine. And then we always have comments every week regarding the specific situation of each one of the countries. For example, the last two cases that were located in a place called Villanueva, that is the northeast of Nicaragua, and the last one located in the municipality of Solotillo, which is very close to the border with Honduras. This immediately puts on alert the situation that Honduras is going through right now, anticipating the epidemiological illness in the zone that we call a buffering zone or contention zone that we will explain later on. I would like to emphasize on this. We have analyzed the situation. We have seen that the cases that have been presented further north in Nicaragua in the last few weeks are not because of the movement or the advancement of the fly, but the animal itself, but through the movement, legal movement of animals. That is why we have insisted that one of the ways that it really helps us, apart from the dispersion of the sterile fly, the epidemiological, is the control of the animals. As long as we don't have good mobilization controls, this is going to continue on happening. But in spite of the fact that we might have good controls, for example, Nicaragua has a very good control, but for the movement of animals, but there are individuals, transporters, sometimes the producers themselves or livestock merchants, they try to avoid those controls and they spread the illness further north, let's say. Imagine a truck moving bovines or equine that can move 200, 300, 400 kilometers in one day, and how much the fly would advance, while how much the worm would advance, while the fly flying, depending on the conditions, would not make it more than 10 or 15 kilometers in a day. These are the situations that we have noticed the most in the last week. Here we see, sorry, I skipped something, I think. No, it's the first time we have the one of Panama. The behavior of the epidemiological curve, you can see on the blue line or the light green line at the bottom, all throughout the year 2023, the cases for each one of the epidemiological weeks, and the red line, you can see what comes from the year to week 35, the year to date. Although we see a very important descent that we cannot say yet, and it's something that we're going to notice in the two epidemiological curves, Costa Rica and Nicaragua, we see that there is a small reduction of cases, but we could not say that this is a trend. For it to be a trend, we would have to wait to have at least 2 or 3 complete cycles of the fly. A cycle goes between 21 and 24 days, so we would have to have a trend of at least 3 cycles, or at least 2 cycles, sorry, and maybe even up to 3 would be the ideal to say that we have a downgoing trend, that is upheld in time, because you can see that the curves are rising and descending, but at this moment in Central America, we have a lot of rainfall. And also, when we have a lot of rainfall, that also affects the advancement of the fly. And it helps us to be able to improve the control. This is the case of Costa Rica. And as you can see, that the new cases up to August the 21st, and then we have on the map to the left side, and the case accumulated through August the 21st all throughout the country. We see the curve on the top. We see that there is significant descent of almost 50% in Costa Rica. But as I mentioned previously, we cannot say that this is yet an ongoing trend. We are making all the efforts. At this moment, I am in Costa Rica. I am in one of the regions here. Till yesterday, we were on the field all day long, looking at how the jobs are done, supervising this job and providing support to Costa Rica. And that is how we are moving through the different countries of the region. Nicaragua also, we see that on the map in the right, we have more, 129 cases in the last week, 35, and the total of cases that were accumulated. We can see that the last cases, which is the northeast of Nicaragua, northwest of Nicaragua, sorry, that is very close to the border with Honduras. We have had this before, and these also in the Department of León. This is the Department of Matagalpa, and all these cases that are here are due to illegal movement of animals that have been able to move through the mobilization controls. We are trying to improve that, but it is complicated because there are many roads or alternate, not even secondary. There are small trails that people sometimes use for the transport of the animals. That is why we have tried and we insist on transporters and producers. Please, it's not that the mobilization is not permitted, but not to move the animals that are under control. And when they go through the control, they check the animal by animal, every stable, and we return the cases, all the in case that there is an infected animal.
We also have a decrease in the epidemiological trend, but we cannot really call it a trend yet, downwards, as I mentioned earlier. Now, obviously, this is not completely updated. These are really the grids, the flight grids. This is how the fly is being distributed, dispersing through the various areas of the country. They move in a kind of crossway fashion, back and forth. This is an example for the Nicaraguan Caribbean from the border with Costa Rica, moving northbound. And this area here has a large natural reserve, and there's a big concentration of livestock in this area. It's one of the areas most intensive in livestock farming in all of Nicaragua, which is why the fly is here. I'm going to go back to the previous slide just a second. A land barrier where flies are being released is being established here. It encompasses more or less this area over here. And here we place chambers for terrestrial release. This was a tool that we did not have decades ago when we had the eradication of the screwworm in the Central American region previously. Currently, we're using this technology, and we are also using canine binomes for detection, and we're placing them in the mobilization control posts, and they allow us to identify infected animals more promptly. What other actions are we carrying out? Number one, we establish areas for containment or for protection, as we are calling them. In these areas, what we do is we do preventive treatment to heal wounds. This is extremely important to convince farmers that we need to treat every single injury an animal has. Any scratches, any cuts. Before, they often kind of overlooked them, but now they have to do it. Belly buttons have to be treated because that is the main area where we find lesions in all of the countries. That is the main area. Then we also have markings, management kind of lesions on the animal. And so we have to improve this. If we treated every single belly button and most of the injuries that the animals suffer, we could promptly, in over 2 cycles, decrease drastically the number of cases. We have to conduct active and passive epidemiological surveillance, and it's important to check on all sectors, not just the livestock sector, but also transporters and the general population as well. For example, I wanted to mention that in Panama, we have more than 62 cases in humans. In Nicaragua, there have been only 2 so far, if I'm not mistaken. I can't remember Costa Rica, the statistics exactly. I think it's 25 cases. I'm not 100% certain about that statistic, but there have been, I think, human cases in Costa Rica and in Panama, where we've had the highest number of cases. And that's where we're working with the public health authority so that they report these cases to us. In fact, the diagnosis is provided by veterinary laboratories. And in addition to this, the dispersion of sterile flies. As you can see, these 4 activities are the ones that are helping us to contain, control, and after a while, we can start envisioning the eradication of the screwworm. So it's not just about dispersing flies. That alone is not going to control this disease, nor just preventive treatment. It's the sum total of these 4 actions that is actually going to lead us to control this disease and eradicate it.
Okay, aquí les vamos a mostrar 3 ejemplos de lo
I'm
que
going to show you 3 examples of what we call the containment or protection areas. This is operational already in Honduras. As you can see here, this is an imaginary line that we're drawing. It spans 45 kilometers away from the border with Nicaragua. And there are mobilization control posts where animal movement goes through to minimize the potential of infected animals coming through from Nicaragua to Honduras. There's a large mobilization of animals in this region, all of this region, all the way to Guatemala and even up to Mexico, because of the trade in livestock animals. So we need to keep close control over this movement of animals, treating the animals. We're placing inspection corrals. We're also placing spray bats, mobile spray bats. In fact, I want to thank the great support that we have received from SENASICA, the National Service for Agri-Food Health, Safety and Quality, because they gave us porta potties to place in the control posts in Nicaragua and a large number of products based on cmafos for the treatment of injuries and ivermectin for preventive treatment in facilities with large-scale infections, infestations. This is a great support from Mexico through the funds that the APHIS, the Animal and Plant Health Inspection Service, has provided through Mexico with a great sense of solidarity. They said the funds allotted to Mexico for the first year, we're all going to support this struggle that we are having in Nicaragua to try to minimize the progress of the screwworm. This is one more example of a containment area that we have set up in El Salvador, where we have 4 control posts. It's also 45 kilometers away from the border, envisioning establishing further barriers for defense. This is the most recent case. This is Belize. We did this 3 weeks ago. We were working together with Belize to establish this containment area with Guatemala. But here, the containment area is less than 20 kilometers. And if you can see the yellow dots here, this is where or orange dots, that's where we're going to place our control posts. And here are some of the actions that we have been carrying out. Both OIRSA, the Regional International Organization for Agricultural Health, as an agency, and also working jointly with the remaining countries and agencies, organizations like AICA, FAO, like OPS, APHIS, in order to minimize and control the impacts of this pest, this disease. Technical assistance to the countries with visits to impacted areas, verifications of health measures. This is something that I'm constantly working with the various authorities. And I summarize these activities here: meetings, visiting farmers, providing guidance on preventive measures in the field, support in health actions, and releasing sterile flies, both in the air and on land. We do this mainly in Nicaragua right now, issuing recommendations to face the situation and design of protection areas, as I just mentioned. OIRSA allotted emergency funds as soon as we identified the problem, almost $1 million for the release of flies in Costa Rica and Panama. This happened between November 2023 and March 2024. And starting in April of 2024, funds were obtained from APHIS, additional funds that are allotted to continue with these releases. But these releases right now have all been displaced. They've all been displaced to Nicaragua, essentially, to try to contain the pest there. Also, national emergency funds were allotted for Honduras, El Salvador, and Nicaragua. Sorry, not Honduras. That's a mistake on this slide, but for El Salvador and Nicaragua. They requested emergency funds, which OIRSA has allotted specifically for these kinds of emergencies in some of the member countries. Meetings with international organizations where we try to work jointly and where we analyze and we take measures for the control of the screwworm. We design training plans at the regional level, supporting all of the countries. All of the countries have the diagnostic capability for the screwworm in their respective countries. And currently, we're trying to have not a single location, but rather in several locations, 3 or 4 locations, whether it's in Costa Rica, Panama, and it's also being done in Nicaragua. But the other countries also have diagnostic capabilities. Well, on the right-hand side, you can see this is called Animal Alert. It's an app, mobile app, that was designed so that countries may, very quickly, people, individuals, a farmer, or a regular citizen, may, in the event that if they have a dog or a cat, there's a couple of cases even in poultry, they can report any kind of suspected cases. This is sent to an email address for the country, and it can allow the people to send a report very quickly. AICA is also designing for Costa Rica. They're working on an app that works via WhatsApp to support a similar effort. Here's more information on the work carried out, the number of trainings in each country, or the number of professionals that have been trained in El Salvador, Guatemala, Costa Rica, and Honduras. As previously mentioned, we have trained staff in the various countries, and this is thanks to the reference labs of COPEC in Panama, who've trained all of this personnel, and now we have that capability in place. Mexico has also offered, and we have leveraged, online training sessions that they've offered and that they've provided to the countries so that more people are trained. A regional workshop on response to emergencies was carried out. It was carried out in Costa Rica together with the International Atomic Energy Organization. It was done in southern Costa Rica in May of this year. And the training of technicians for the diagnosis and identification of the screwworm was carried out in April in Panama, and materials were obtained and supplies to prevent the screwworm at mobilization control posts in Honduras. But also, again, through the APHIS funds, we are purchasing equipment and supplies so that we may have sampling kits, to send these samples to the labs and the necessary equipment so that prompt diagnosis can be obtained in a term of 24 to 48 hours post-sampling. We've also tried to make sure that the samples are promptly sent to the labs. Here in Costa Rica, recently, the use of email has been implemented. The email is used to send the samples, sorry, not the email, the mail is used to send the samples in, and in real time, the labs can respond with a clear diagnosis. We also have been working with the obtainment of materials to heal wounds, supplies to heal wounds. Webinars are being carried out on the screwworm, like this one here. We have held one with 348 participants. We developed working plans for the containment and eradication of the screwworm in Costa Rica. This is through USDA APHIS funds for $4.9 million for a time frame of 2 years. And for the 3 countries, Nicaragua has been infected, but since this was agreed upon before they were infected, these USDA APHIS funds for 15.4 million funds were assigned to these so-called free countries to work on screwworm prevention. Also, AICA is implementing the training and educational campaign to share information on the screwworm, which also leverages APHIS funds. OIRSA drafted a comprehensive management plan for the screwworm throughout the OIRSA region. Countries can adapt it to their own specific needs. They can tailor it. Containment and surveillance plans for Honduras and Belize, and also a framework for technical cooperation program with FAO, which is very important, where we're supporting the carrying out of a project for technical assistance at the emergency level. It's already in place. We're going to conduct 2 workshops, one in Nicaragua in person for the countries, and another one subsequently in Honduras. The one in Nicaragua will happen next month, God willing. And that's what I had to report. Sorry if I took longer than I had assigned, but it was a lot of information and I tried to summarize it as much as possible. Dr. De Gracia, thank you very much for your presentation. In just 1 more minute in the Q&A session, we will channel the question for the doctor. Alejandra. Thank you, Octavio. Now we have the pleasure to introduce Dr. Armando Garcia. He's from CPA Sinasica. He's a veterinarian. He has specialized in veterinary medicine and animal zootechnicals, and a master's degree in public health from UNAM. His field of experience encompasses veterinary medicine, public administration, and public health, focused on prevention, control, and the management of animal and zoonotic diseases. Currently, Dr. Garcia is the director of the Commission for the Prevention of Aftos Fever and Other Exotic Animals, which is also known as CPA, where he leads the programs for epidemiological surveillance and coordinates strategies for the prevention of exotic pests and diseases in Mexico. Dr. Garcia, please go ahead. Good morning, ladies and gentlemen. First of all, I want to thank you for this opportunity to exchange information with you. Very valuable information. It was great to also see Dr. Alejandra Gracia. We coordinated together several of these efforts, and all of these aspects presented so far are very important. 2 important points that are worth highlighting in my presentation. As mentioned by our Director-in-Chief, Eugenio Calderon, Mexico still doesn't have disease. However, point number 2, it's the first time that a national emergency system was activated. And with this, I think that there are some other people from the center, from Central America, have more experience on this than Mexico. Yesterday, I had an opportunity to talk with some of the other people, and here they really didn't know what we were doing. So that's why all of these are very important activities. It's very important to hear of all of these activities. I'm going to put my presentation on screen. Can you please confirm if you can see my screen? We can see it. Please put it in presentation mode. Well, the Mexican strategy, it also entails taking certain actions that allow us to tackle this disease head on. Unlike other diseases, we know where it's coming from, and it's traveling south to north. This is an enormous advantage for us. So the system that was activated at the national level also is aimed at controlling the southern border. Mexico has all of these problems. I'm sure all of the countries have shared these same problems. Things like the illegal movement of livestock, irregular migration, international trade, illegal pet trafficking, and organized crime. But something that De Gracia mentioned, which is very important, is that really the problem is that the pest is being spread because humans are the ones who take infected animals, load them onto vehicles, and do everything possible to evade the official barriers that we set up. So the most important question is, how much value does an animal have versus the whole risk that this terrible disease is presenting? But this certainly is due to a lack of information that is complex for us, because 31 years ago, the disease was eradicated. In Mexico, the new generations of veterinarians in Mexico and surgeons have not had the opportunity to work with this disease, and they don't know the kind of potential damage that this can cause or how to treat. One of our main focuses is precisely how to treat wounds. This was mentioned several times. We activated the animal health emergency system, which allows to activate every human, material, and financial resources to minimize the risk of parasite incursion and spread. The system is activated for 6 months, but it can be renewed for an equally lengthy period. What is the prevention strategy? Now, obviously, it's very important for us to enforce control of movement at the southern border. We have a few inspection posts. They're very well established, especially also for migrants. This involves Senacica, the National Immigration Institute, meaning there's a lot of people involved in these two posts, but unfortunately, they did not have restrooms. They do not have baths. At the location, we use spray baths, which was the technology that we had. Currently, these spray baths have sufficient pressure to provide a good coverage over the animal bodies, but it's not the only measure. And in terms of, as the spray baths are working, all of the procedures will be established to properly detect the presence of larvae, supported by the canine units. We all know that oftentimes livestock is transported at night because it's more comfortable for the truck drivers, but that makes it difficult, because even when you have a lot of good systems in place, it's complicated to check the whole animal surface at night, and canine units are great. Now, creating awareness and sharing information is very important. Again, collective knowledge of this pest is vital. More than 30 years ago, people coexisted with the disease, but the population knew what to do about it. Currently, the cases are very complicated, and they're complicated because people don't take care of the wounds. They don't attend to them promptly. And this can even lead to the loss of an organ, even in a human being. Now picture that in an animal, where care is much less, usually. Likewise, distribution of collection tubes and larvicides is occurring. They contain a device that collects only the most important data that we need for discernment and for reporting. And also a little sachet that you can see there in the picture that helps the injuries heal. We give this to any person that has animals, any person who has livestock, any kind of livestock. The De Gracia was mentioning the presence of the disease more in towns, small towns. And, oftentimes small towns have these stray dogs and nobody owns them and they're just hanging around. And if they get the disease, often it goes by undetected. And they can be a source of infection. The recommendation here is any injury has to be treated using this powder after having removed, obviously, all of the larvae. Some videos are being filmed to show how the injuries have to be treated. We have these videos ready, and they will be able to be shared even via WhatsApp. We want the population to have the information on what to do. The premise is if there's no injury, then there's no screwworm. This is an advantage that we have, is that by reducing the amount of untreated injuries, we will reduce this disease. Now, for movement control, the plan that we have developed is more or less the following. You can see it in the picture in the lower left of the screen. Starting from meridian 92 and parallel 19, we have a line to separate the Yucatan Peninsula. And you can see there in the central picture the centers for comprehensive attention of border control and transit control. There are three. They are very important. I will show them to you in the next picture. Most of the livestock goes to the Cosoamalopan Center and Catasaja. Why am I mentioning this plan with this information on the screwworm and the control post? The situation in Mexico and in every country is that a lot of livestock goes through from the south towards the center of the country. This can be in the state of Michoacán, Querétaro, and more. But the point is that the geography of the country allows us that if we leverage the scope of action, we can catch the disease more easily in this narrow point of the peninsula. And it's very difficult otherwise to cover it because Mexico is a very wide country, more than the rest of Central America, and it's going to be harder to contain it further ahead. Which is why we've designed these controls near the southern border, and we want to establish a second control barrier to allow us to verify, number one, that they went from the first barrier. And also, we can apply certain controls and bats at a second stage. Spray bats. With this, we can guarantee that any livestock that moves towards the north of the country does not have any kind of larvae with them. Obviously, when we all discuss this, what we notice is that oftentimes people are not informed, they try to evade the barriers, and they're trying to figure out how to skip the control positions. So movement control is a very delicate point. It's the basic step that we need to do carefully because they are moving along with the vehicles. It's important to keep control of the biology and control of the fly. It's moving fast northbound towards the areas towards the center of the continent. They are moving there because we haven't created sufficient awareness about this. The commitment would have to be that any individual who transport livestock be sufficient aware of not loading this onto the vehicle if the animal is sick. In addition, they have it in a trap where they weigh it, where they do all of the paperwork for mobilization. It's just an issue of doing an inspection there, animal by animal. It's very easy, but unfortunately, our culture sometimes only thinks on how to not comply, and they figure, I can evade the post. And they say, hey, you know, it's a problem to load an animal infected. Why are you loading it? And they say, oh, don't worry, this is going to Honduras. This is our mentality. They think that if we offload the problem into someone else, that's not going to impact us. But here, we all have to learn, and we all have something to add, and we all need to cooperate.
These new facilities of the showers, where they are pre-manufactured. They have a mechanism to recover the fluids and to dosify again. Once many animals go by, well, there's a possibility of recovering some of the fluids, and with that we can do a better application. Fortunately, we have other technologies that for 31 years we have had. And one of them is what we call the assisted diagnostic, and this is to receive an image, and with that, to be able to identify it with some entomologists that are working 24 hours a day, 365 days of the year. And with that, we can identify if it is a screwworm or not, because that is very important. The injuries are different, but nevertheless, in the case, due to other obligations, well, obviously, this animal is also going to be subject to this place of origin, different to other places where this has been treated. The advantage would be, but we can also, a person who has a doubt regarding if the dogs, cats, or any other pet that they might have in their house, they might have this larvae that was detected, might be a screwworm. Well, they can see the image, upload the image, and the entomologist will interpret it. Or they might ask them to move, take a photograph with better light or something. Or if they move, you can use their cell phone and have the opportunity of being able to discard if it is true or not. The formulation of the dosage is very important, and therefore it is understood that there is an informational material that is going to be done. But for example, in Quintana Roo, Campeche, Veracruz, they have been installing a loudspeaker in the vehicles and to talk to the people to warn them about the possibility of this, as well as they have done spreading of information. There is informational material that is available in more than 189 in the national system, as well as other activities that are pamphlets and posters that are going to be handed out through the stores of supplies and input. And there are some videos also, among many of other things that are being done independently, of direct presentations that are done at the universities. And they're talking very strongly so that we can provide all the information possible. This is a scheme of things that are being handed out free of any charge. All the information to know where the reports have to be made, and has a very basic instructive so that people can identify for the people that listen to us. We also have asked to take a sample of the deepest part of the injury so that we might be able to identify if it is the screwworm or not. There's also an online course that is being taken by some of the countries in Central America also. And eventually this is a very friendly platform. If you want, you can go in and check this. It is not necessary, but a veterinarian physician might be, or any person that might have contact with animals, and this is something that will.
Como ejemplo, dar en algunos países como Argentina, Belice, Brasil, Costa Rica, Ecuador, El Salvador,
Mexico has collaborated with the training of technicians in countries like Argentina, Belize, Brazil, Costa Rica, Ecuador, El Salvador, Honduras, Nicaragua, Paraguay, with more than 486 participants. All they have to disconnect. We have been doing all the dissemination possible through the different organizations in the livestock production organizations, and anybody that might be requesting information to be able to see the conferences. We are also attacking that part of disseminating the information, and this has helped us spread better knowledge throughout Central America and to the north of the country, and to be able to be more aware of the situation. About our job, accumulated jobs, and after acknowledging the effort carried out by Orisa, Dr. Velardo, that is monitoring every week. Every week we go online and say how our statistics are working. So you have your the job that are done every week. We have a control, a record of statistics of all the countries. Giving talks about the screwworm, and we are giving comparisons between other. And this corresponds to the states of Tabasco, Chiapas, and Quintana Roo, and other places, with 1,148 presentations given. Participants in 48 presentations, sorry. And then we have another 120 presentations throughout the country. Epidemiological surveillance due to suspect of the screwworm. Thanks to this, to the participation, we have been able to discard the appearance of the illness. As you can see, August 15th, we had 50 possible alerts, more than the whole year, practically. Which are the species that have reported made the most amount of reports? I think that this is logically because of the access to internet. For the promotion, it has been more in canines. There are more pets. And the second would be the main species in all the countries, which is the bovine. I think that's joint statistics within time will multiply. to go to the smaller animals, to the
Si no, si todos estos reportes no han sido gusano gobernador, entonces
even though
bueno,
the
las especies no
here we have the species that have been identified. I'm not going to go into that, but obviously all that have been reported have been negative. And for the screwworm,
un país libre de
Mexico is at this moment a country that is free of that illness.
moscas.
But there are other larvae, other flies that have presented that
Para los trabajos que ya estamos
for the jobs that we are carrying out
se han contratado médicos
in the south border, we have hired more veterinarians and to reinforce this.
Y regresando a los 28
And
días,
they are doing tours every 28 days because the cycle of the fly is the 21 to 24 days. So they visit once again the same farm. First, they have been going to the farm, handing out the materials, information, and then for the inspection of the livestock, telling them to look at all the injuries that might appear, especially that of the dogs, so that those injuries also caused by the horn, of the cattle. So they give the information and the possibilities of being able to heal those things. There's also controls and they are visiting the farms, but it is also they are doing this through their phones. It is very important to have a communication with the producers through a quality management system and to be able to attend to any possible suspicious infection in less than 24 hours. This is something that happens. And we train our technicians so that they can check the affected animal and be able to make a spot diagnostic. This is a very special.
Los equipos de microscopio electrónico que se les proporcionó permiten tomar fotografías mucho más exactas y enviarlas por el teléfono.
There's also the possibility of sending the photographs of the possible infection through the telephone to have the diagnosis. Our border is protected by this group of human resources, and therefore we are very much identified by all the population. But apart from that, these are the most common places through which cattle might be transported through cross-bordering, and this is where we try to detect the suspicious cases. As mentioned,
también, doctor de Gracia.
And also, with the idea of being enacting
muy regional, pero regional no en el sentido de cada país, sino muy solidario con lo que está pasando. México ha aportado 90,000 sobres ahorita de Comafos, que es este sobrecito, el cual permite hacer un tratamiento muy efectivo de las heridas, pero que además favorece mucho la eliminación de las larvas. Quitan todas las larvas que son físicamente las que se ven, ponen el polvito pensando que ya son todas y no empiezan a salir más inmediatamente. Entonces, sacar las demás y lo vas a poner, más 300 frascos de tin que se han dado en el pollo. Ahorita en Nicaragua doy la noticia de que hoy llegan los agentes aduanales para que se embarque estos medicamentos y se puedan ir a Nicaragua. La estrategia tiene sus puntos claves, que es la prevención para nosotros en México de los antiparrinador, la activación del INESA que ya se hizo, fortalecimiento de las barreras de sur, el apoyo de los organismos de certificación para la prevención minuciosa del ganado mediante su personal y terceros especialistas, y muy importante la promoción e identificación de casos sospechosos. Todo esto con la finalidad de que estemos actuando junto con la sociedad civil. Me mencionan que las personas que tuvieron la campaña, que con la participación social, fue como más avance se tuvo en cuanto se hizo conciencia de la enfermedad, llovían las notificaciones y por lo tanto las atenciones de estas mismas notificaciones. Pues muchas gracias, es todo lo que les puedo comentar y quedo pendiente para las preguntas.
Doctor García, muchísimas gracias por esta importante información que nos transmite. Para continuar con nuestro programa, quisiera presentar en este momento a Alejandra Díaz, que es quien nos daría la siguiente charla. Alejandra tiene una maestría en Tecnología de los Alimentos, por la Universidad Nacional Agraria La Molina de Perú. También su experiencia profesional incluye áreas de inocuidad y calidad, normas y reglamentación alimentaria, promoción y facilitación de las exportaciones. Actualmente Alejandra es especialista internacional en sanidad, agropecuaria e inocuidad de alimentos del IICA y brinda apoyo a los países de las Américas en materia de medidas sanitarias y fitosanitarias, formulación e implementación de políticas regionales y nacionales, procesos de modernización institucional y planificación estratégica, reglamentación técnica y programas de inocuidad, calidad y facilitación de las exportaciones. Sin más preámbulo, los dejo con Alejandra. Muchas gracias.
Muchas gracias, Octavio. Bien, voy a compartirles pantalla. Entiendo que ya se ve la presentación.
Sí, solamente nos falta que se vea modo presentación.
Gracias, Octavio. Bien, en estos minutos voy a aprovechar para compartirles un breve resumen sobre la iniciativa que hemos arrancado en conjunto con USDA y obviamente también bajo la coordinación con las diferentes organizaciones que el día de hoy nos acompañan, para apoyar y contribuir con los países en materia principalmente de la comunicación de riesgos. Entonces, antes de eso, de todas maneras, quería mencionarles cuál es el móvil o el espíritu de trabajar la comunicación. Bien nos señaló Abelardo los 4 puntos muy importantes en el tema de la contención, en la importancia de la vigilancia que tienen que realizar, todas las acciones en la cura y el tratamiento de las lesiones y de las heridas, etc. Sin embargo, consideramos que hay un elemento esencial que cruza a través de todas estas medidas que son sumamente importantes. Y esta es la comunicación. Consideramos que con el esfuerzo de hoy, por ejemplo, lo que estamos haciendo es informar con información veraz, precisa, exacta y sobre todo a todos los interesados. Queremos, además de informar, lograr el involucramiento de todas las personas. Y claro está que buscamos también incidir en un comportamiento y evitar de esta manera que se propague el gusano barrenador. Y adicionalmente, hemos visto cómo han circulado por diferentes medios también información errónea y algunos rumores, sobre todo en las zonas rurales, porque ante una situación como esta podemos tener percepciones diferentes de aquellos que están escuchando cierta información y en algunos casos puede generarles preocupaciones, temores y obviamente y eso va a significar ciertas acciones por parte de ellos. Entonces queremos también corregir información errónea y con información exacta y veraz. Pues bien, con ello señalamos nosotros que la comunicación es parte integral de las medidas de prevención, de control y erradicación del gusano barrenador. Y esto no solamente es en una situación de emergencia. Realmente la comunicación se da en tiempos de paz y en tiempos de crisis. Entonces tenemos que entrar con una argumentación clara hacia toda la población, hacia toda la sociedad civil, como nos indicaba anteriormente el expositor, para poder lograr entre estos elementos que les señalé, incidir en el comportamiento. Si vemos que esta situación se amplía más, si está superando nuestras capacidades, pues obviamente hay un protagonista importante y sobre todo y particularmente para el tema de hoy que vamos hacia la producción de leche y tenemos que trabajar realmente alrededor de ellos. Ciertamente, no todos percibimos el riesgo de la misma forma. ¿Esto qué quiere decir? Que por un lado nosotros tenemos a los expertos, a las autoridades, haciendo un análisis de la amenaza, haciendo la evaluación de los riesgos y seguramente a través de las diferentes medidas nos van a indicar qué cosa es riesgoso. Nos están indicando, miren, esto se está dispersando, esto se está superando incluso a las tecnologías modernas que tenemos y nos están dictando las medidas preventivas y en algunos casos ya las medidas de corrección. Sin embargo, por el otro lado, nosotros tenemos a todo el resto de la población y a todo el resto de la población también está decidiendo qué es riesgoso, pero lo está decidiendo con base en sus valores, con base en sus emociones y con base en sus preocupaciones. Entonces podemos tener aquí una gran brecha y a través de la comunicación, a través de los esfuerzos que estamos en estos momentos articulando y coordinando, queremos llegar y reducir esta brecha para que esta población en general, no solo los productores, sino también los dueños de mascotas, las diferentes comunidades que pueden ser incluso hasta más vulnerables en zonas de frontera, realmente entiendan que es riesgoso para ellos con base a esta información basada en la ciencia, basada en la experiencia y basada obviamente en la mejor forma de entregar la información. Algunos puntos claves. Tenemos que entender que las personas responden únicamente ante los riesgos que perciben. Si están y se sienten y perciben que el riesgo es muy lejano, obviamente tendrán una actitud de indiferencia, una actitud de apatía. Pero si nosotros hacemos que esta información le genere temor, le genere miedo, probablemente levantemos la indignación y podríamos estar generando también una crisis. Entonces tenemos que posicionarnos y buscar un balance en el marco de la comunicación y tratar de llegar con esa información simple, con esa información que les ubique realmente dónde está el riesgo respecto al gusano barrenador del ganado y realmente con ellos trabajar y actuar conjuntamente. Ciertamente, ya lo señalaron en las presentaciones anteriores, nos estamos enfrentando en un espacio y un
space of a context that is completely different to the ones we've had. Certainly, there is more. Abelardo mentioned it. We can see how the actions are being taken and how it has been contained and how this is advancing. But we also have new ways of communication through social networks, and we can coordinate. Before, we only had the possibility of doing spaces of face-to-face dialogues, but we're also coming into the context of facing the shorter resources or less resources. We have to make the analysis to face or provide and face that wrong information that might be circulating through the momentum of measures for control, prevention, and contention, making it simple in a harmonized manner for spaces that only in prevention, like in the case of Mexico, that doesn't have the pests, in a different way to those countries that are already facing this problem. In reality, here we have the perception that at the end the person might have, and to be able to make the awareness, this perception in reality is real by the people. And they are consequently going to act when they feel that there's some real threat. So that is why we consider that this component is very important if it is transversalized through the other situations that were commented previously. And with these in mind, I'm going to mention that this project that has started, it started in the month of July with the planning throughout the 8 countries. These are resources coming from Itapexi. And we have apart from the countries of the region, Central American region, we also have Mexico. And I'm going to mention the 3 main objectives. Our first objective is related to training. To the training, not necessarily of the technicians. That is the strength that Orisa is working on, that they are developing, but our training goes, and our efforts are aimed at all these communities, to all those other group of persons that are perceiving this in different ways. So the objective, the second objective, is to elaborate or to find the information resources that are most adequate for this. We have distinguished through the different national actions that we have collected throughout our offices in the presentations of different countries. We have found diversity of training activities, of socialization, and we have identified that the main priority in the majority of the countries is the livestock, the cattle, both in Central America as well as in Mexico. And the second place, and with a greater intensity in some of the countries, is the aspect of the indigenous communities. So, from this moment, those specific groups are our main target. And the third point is that all these resources of information, not only are we going to have them in printed material, but also in a digital manner and through a web page, specific web page, specifically for the screwworm, but especially that we are going to go online through the communication media, through social networks and digital means. In zones and other communities, we have to continue on using the local radio to be able to do the transmissions, to make the receptive ads and so forth. And that is what the actions, national actions are focused on, that our representations are coordinated and through the different veterinary services and the directories of animal health. And also, obviously, we would be working on some regional actions to promote the exchange of the information, the exchange of the lessons that have been learned, and the adjustments, obviously, of any program or initiative of this characteristic. It requires to incorporate and improve in this process. We have concentrated the maximization of this, the different groups, and particularly like the one that we are developing right now with the private. Dissemination with agricultures, with operators to continue on working with the communities, the vulnerable communities, the capacity for the tenure of risk, these elements that I have mentioned as the basic principle, and the development of skills in our technicians, in our communicators of risk, both at the Ministry of Agriculture as well as in the veterinary services. And to continue on contributing with the development of training materials. We don't want to double the efforts. What we want is to continue to complement the efforts that at this moment are being carried out. For example, we have had recently a workshop done for indigenous women in Costa Rica, where we took advantage of the space to work with them, and the workshop that was particularly for the screwworm, and also to collect information, very precise information as to what job has to be developed with them directly. This is located basically in different sectors, but it even shows us that there are practices or traditions or desperation, for example, to be able to attend to the topic of the application or release of the worms, like, for example, using even gasoline in the treatment of this pest. In El Salvador, yesterday, we have also developed some trainings at a very basic level, and this obviously in a perspective of prevention, because it's a country that doesn't have the pest either, and that we have to be ready in view of a situation that further on might work on simulation exercises. As another objective for the information, you have seen there's a diversity of very interesting information, of which we have, like in the case of Senacica, or that of the information provided by Orisa. And we are preparing specific resources, be it for the livestock, for the producers, and resources also for the educators. Because we can do all the efforts now to make the contention and to come into an eradication stage. But nevertheless, if we want these actions to be left available, we have to think about the future. And coming to the future, we have to work with today's children, boys of today, the youngsters of today. So the resources for educators, and also to promote within the children and to understand what is really what is a screwworm, for example. One of the materials might be used to complement the effort that they might develop, be developed by the educators, by the teachers. The resources for the civil society, for example, the topic of livestock and what to do about it. Resources for indigenous communities, as I mentioned, which obviously leads us to the challenge of establishing it in other languages. And clearly, and although it might sound very nice, yes, we're going to work with the material and we're going to have it translated into other languages. Well, we also have to acknowledge that there is a very high level of illiteracy, that even though if we put it in the language that they speak, they're not going to be able to read it. So we would have to use other resources, like audios, for example.
Just as a means of example, looking at the progress made jointly with OIRSA and also with Quebec in Panama on the material for Belize, approved jointly with the various organizations, the material for Costa Rica, and this one, which we really like, the one from Mexico, that we are developing together with the CPA, with tents for travelers and materials that are being developed, and we will continue improving in this aspect to create further awareness and to inform the people about this. But we also must be present at the forums where there is a larger amount of people, of our target audience, that we want to engage and get involved. It's not sufficient to have these materials solely in digital format. We need to approach these forums, such as livestock fairs, where we were present in Panama, for example, several days, explaining to the audience at large, not just livestock farmers. This is a stand that we prepared with all information on the screwworm in Costa Rica. This was as part of a livestock conference that was carried out in a rural area of Costa Rica. And finally, we need to focus on campaigns through digital media and social media. We've already started this effort, creating material for social media and digital media. We've already started by making posts, but also that entails doing an analysis of the metrics to make sure that we're actually reaching our target audience. And in particular, whether we're having the expected impacts or not. We will have a specialized website set up for the screwworm, where we will be encompassing every single one of the materials being developed, and that other countries will also certainly share. The idea behind this is for us to place here material that can be edited so that other interested parties, other organizations may simply download it. We inspired our effort in the CDC's webpage for the management of a different disease, but we definitely consider that it's very interesting, in particular, to leave all of these resources online, ready to print, and if they're in an editable format, it's easier because people can simply change the name of the country, change some and tailor certain things, and make it useful for them. And this will make our efforts more flexible. That's essentially it so far. And certainly we see each other in other forums sharing further details on the results of these efforts. Thank you very much.
Alejandra, muchísimas gracias
Alejandra, thank you very much for informing us on this information campaign that you're conducting. I think it's now time to start with Q&A. We've received many questions. We're only selecting a few. And any question that we are unable to answer live, we will answer you directly via email, the email that you registered when you were enrolling for this webinar. The first question is addressed to Dr. De Gracia, and it's from Eric Moreno. And he says, thank you very much for the presentation and events on these topics. Preventive actions that can be carried out at the farms are limited and focus on the adequate care of meiosis and the treatment of wounds or lesions in animals. I think that the distribution of sterile flies of the new strain is the only effective way to control this pest. We're concerned about the installed capacities in Central America and Mexico. Additionally, the flight grids are limited to the northern countries impacted. Currently affected in Nicaragua, which leaves Costa Rica and Panama unprotected. The question is, what actions can be carried out to improve the distribution of sterile flies in countries where the screwworm is already present? Let's see. Look, I want to go back to the fact that it's not only the sterile fly alone that can contain this pest. As Dr. Garcia well said, and a warm greeting to him. I also see Rocio over there. It's 4 measures that we need to implement. There is a single plant in the world that produces sterile fly, which is the Panama plant. And that plant has the capacity of about 100 million flies weekly. This plant was producing approximately 20 million initially. You can't overnight ask them to produce. They're already producing at maximum capacity, and it took them a year to reach 100 million flies produced. And so there are simply not enough flies to do it in Panama and Costa Rica as well. So we had to pick. We had to pick transferring most of the flies northward, where the battlefield currently is, on Nicaragua and the border between Nicaragua and Honduras, to try to contain the pest. And the other measures are being applied in Panama and Costa Rica until we can control and lower the cases like it was done 20 years ago to control the fly. And we acted from north to south. There simply aren't sufficient flies. There is no other location producing these flies. This plant is already an aging plant. This facility has to be modernized. Perhaps their system for sterilization, which is cobalt-based, needs to be changed, and maybe using a better X-ray system. But this costs money and time. So these are the limiting factors that currently exist in the program, aside from other circumstances, such as not having sufficient resources. Please remember that the countries, when you eradicate a disease, there's a trend of decreasing funds for it. So we always have an issue with a decrease in surveillance. We don't have sufficient staff. Farmers forget that they have to be treating wounds, etc., etc. So it's a series of measures. We cannot say sterile fly is going to control and eradicate the disease. No, that's not how it's going to happen. No, regardless of how great this fly is, it alone will not solve the problem. It's only a part of the solution. There are other 3 aspects that are up to us. Thank you. Thank you very much, Doctor. I have another question from Arturo Solorza, who says, Dr. Avalardo, thank you very much for your presentation. In Costa Rica, we've recorded the resistance of several pesticides known as pyrethroids, among them permethrin, dextrometrine, and symptometrine, due to mass application for the fly. Now, I see a lot of livestock farmers seeking companies that offer solutions to bathe the animals. We hope that it's not There's no cross resistance. Due to the relevance of the strain used to release sterile males, every how often would these be replaced, and will it be with virgin females or some other method to maintain?
Saludos, Arturo. Miren,
Greetings,
son
Arturo.
varias cosas.
Well, there's several things there. Number one, yes, the problems that are being used or that are being recommended by official authorities have been tested, and they are working very well. I'm aware of this. Right now, we're in Costa Rica. We spent 3 days in the field, and the products are working very well. I'm not going to mention the brand names for obvious reasons, but the problem is that there's people who are using not recommended products, even products that are not for veterinary use. We've seen cases where people are using bygone or other home insecticide, which are not for veterinary use. So that's a problem. Aside from certain empirical blends of certain products, that's not recommended either. We tried with Kumafot, a product that is being used in Panama. We are waiting for the health registration here. This has been donated by Mexico. Mexican scientists tested it in Panama and Nicaragua, and the product worked. It worked really well. This product mentioned by Armando is completely effective. It was donated by Mexico. We don't have any issues with it. It's a product that we use it. Those of us who are a bit young, we used it during the first campaign for the eradication of the screwworm. It worked well, and it continues to work well. It was tested with technicians from Senacica in Mexico, in Panama and Nicaragua, and we're certain that it works perfectly. Now, with regards to the fly, let's see. Initially, what happened is that they were using a strain of fly that was a very old strain, and it was used initially, it was Jamaica number whatever. Now, the new strain that is being used is a strain that was extracted from the wild fly, and it is working, and tests are being conducted on it. I cannot tell you exactly every how often they will be assessing this, because that's an answer that COPEG needs to give, because they're the one who are managing and controlling the production of sterile fly. So I would rather that question be addressed to staff from COPEG. They are the only ones authorized to speak on that topic. We never noticed any cross-resistance or any shifts. I'm not aware of that, but we must understand that the screwworm fly is slightly different when compared to the Mediterranean fly, which is the other type of fly that there's a project for. But the biological cycle, the way it's contained, is different in the screwworm fly. We have a disadvantage that doesn't exist in the other Mediterranean fly, that we have any warm-blooded animal is susceptible to it. And they help the larvae, the myiasis, to displace itself many kilometers over a single day. And that makes the situation a bit more complicated with the screwworm fly. Thank you very much. One final question, Doctor. I think that this one is very relevant. We're being asked, what are the reasons that led to the resurgence of this problem? This question is brought forth by Francisco Arias. Is for me that question, Octavio, or? Yes, for you, Doctor. Okay, thank you. Well, I think it's multiple factors at play. I mentioned a few already. A decrease of surveillance because of the lack of resources.
disminución
In
de los
Darien,
vuelos
there was
y de la
also a
concentración
decrease in
de
flights
moscas que se
and the
dispersaban.
concentration of flies being
Información que
dispersed.
tenemos de COPEC,
This is based on
porque los
information we
científicos
received from
evaluaron,
COPEC, because the scientists
trabajan y evaluaron que
who
podían hacer
work
algunos
there
cambios,
assessed that
y
some changes could be
entonces
applied,
creemos que eso
and we
contribuyó. El
believe
cambio
that
climático
contributed.
influenció mucho
Climate
la
change also
migración,
had a big impact.
la
Migration,
alta migración de
high
personas
levels of
que llevan
migration of
animales,
people who bring
llevan
animals
perros
with
con
them.
ellos.
They have dogs with them.
Inclusive, eso no lo llegué a ver, pero sí me lo
This,
contaron.
I didn't see
hasta
it
con
myself, but I
algunos
heard it.
insectos. No sabemos
Sometimes
si
they
estos
migrate with a
animales pudieron
pig.
haber traído
We don't know if some of those
la
animals
tormenta. Entonces,
also
suma todo
had the
y
screwworm
tenemos
fly.
la tormenta
So
perfecta,
that all adds to a
¿verdad?
perfect storm,
Es
right?
exactamente lo que la
That's
pandemia,
exactly what we have. Oh, the pandemic.
la pandemia contribuyó
The
mucho,
pandemic
porque
contributed
no se
heavily
podían
to
hacer
this
los vuelos
because
necesarios.
no, the necessary flights could not be done.
Ustedes recuerdan todo lo que sucedió.
You remember everything that happened in the 2 years of the pandemic. All of these things added up together, resulting in the perfect storm for the resurgence of the screwworm fly impacting us the way it currently is. Dr. Abelardo, thank you very much. The second question is for Dr. Armando Garcia, and we're being asked, are you aware of whether in Mexico there are any plans to produce sterile flies in an immediate future? This is asked by Dr. Gabriel Leon Gutierrez. I'm not aware of anything in the short term. I don't think it's possible to produce this in the short term in Mexico. Thank you very much, doctor. Next question for Dr. Armando. We're being asked, in terms of lesions and detecting wounds, is it possible to confuse it by confusing it with the lesions caused by other types of flies found in southeastern Mexico and in countries of the Caribbean? As mentioned, there's a large variety of larvae that can be found in injuries and wounds. But this one is feeding on living tissue and deep tissue. So we need samples from very deep tissue in order to rule it out. We cannot rule anything out unless there's an entomologist that identifies it well. And I wanted to mention that telediagnostics does not replace having to send in the sample to the lab for its analysis. So I would suggest the most important thing, and if after all of this, there's anything that you can take home from this session, is please notify. Please take the sample before you eliminate the larvae so that they can be sent into the lab and destroy any larva. Do not allow them to spread, because in the cycle of the flies, they will generate further pests. Thank you, Dr. Armando. Next question. Rosalidia Hernandez asks, if by mobilizing cattle for slaughter, you detect myiasis, should it be sent to the slaughter or should it be sent back to the place of origin? Is there any sanctions for the people who did not check properly? Well, right now that there's a preventive campaign, if it reached the slaughterhouse, then we're in trouble. But honestly, right now, if you overcome the barrier, you go back to your place of origin. If it has to go through an inspection post, obviously they will be detected. And otherwise, samples will be taken and the traceability of the origin of the livestock will be done in order to visit the farm and figure out what's going on there. Thank you very much, doctor. We have another question
¿Cómo se han entrenado los caninos para
from the press. How are canines trained to identify the larvae of the screwworm, considering that Mexico does not have the pest? Fortunately, the sense of smell of canines is much more developed than those of humans. And there is a very characteristic odor to this, even for humans. And if it is for humans, it will definitely be characteristics for dogs. And we train the dogs thanks to contaminated gases, the screwworm fly. Obviously, we didn't bring larvae over.
Muchas gracias, doctor García.
Thank you, Dr. Garcia. And we have a follow-up question for Alejandra. Alejandra, we're being asked, have workshops and presentations been given to children and young people throughout the region? Right now, presentations are being provided to livestock farmers. We need to consider this. It's a problem of public management, but it's also sectorial. We have to coordinate with the Secretariat of Health. The Secretariat of Health will help us for the checkpoints for migrants, and they will also design a strategy that allows to reach the schools. We are focusing in the area of competence for Sinasica. Thank you, Doctor. Alejandra? Yes, to add. Yes. It is part of our schedule. We want to reach out first of all the schools, teachers, and then with them, we want to seek out the appropriate designs to reach children. That's part of our schedule. We'll be making progress on this in 2024, but definitely by 2025, we should have that implemented. This also invites it to share experiences on how to tend to problems and crises, health crises in other countries. And we are looking at success stories from other countries as well. Thank you very much, Alejandra. We have a number of additional questions that, if you will allow us, we will be answering directly to your email addresses. Dr. Garcia, there's a lot of interest in learning about the courses that you mentioned. So we will ask you for that information, and so that we can share it through our social media, and in particular with all of the people who participated to the various webinars, so that we can share awareness of this training program that you have available, and to cooperate with the government to support many more people to be in touch and be aware about the presence of this meiosis. In conclusion, for today, I would like to mention 3 main points. Number 1, based on today's conversation, we believe that there's a strong need in Central America to focus from preventing the progress of this pest throughout the region. All of the countries are participating in this, and also APHIS and USDA. Mexico has actively participated in this, and they have activated their national animal health emergency system, which involves control and surveillance by establishing quarantines to prevent entry, and the creation of awareness and providing training. And one of the key strategies for the control of meiosis is to share information, to create awareness about strategies for prevention and for control, and also development of skills for detection and responsible treatment plans. I don't know if Alejandra, you have any additional remarks to make? Thank you, Octavio. I believe that among these closing remarks, it's worth highlighting also the high level of coordination and cooperation that we're developing among countries and institutions. This strong effort with the private sector, which I believe we can continue developing through a specific working plan for the upcoming 2 years. Thank you very much, Alejandra. I would like to ask Rocio Camposano, representative today for Dr. Diego Montenegro from the AICA office in Mexico, for some closing remarks. Rocio, thank you very much. Thank you very much, Octavio, Beto. Thank you all very much for the opportunity to have AICA here participating with you in creating awareness, spreading knowledge on the preventive measures. On behalf of Dr. Diego Montenegro, the Mexico representative for AICA, we close this seminar thanking you for your commitment and your engagement in preventing and controlling screwworm. This pest continues to be a challenge for livestock farming in Central America. Its impact is devastating and can be further devastating, not because of the direct loss of animals, but because of the associated costs for treatment and prevention, which impact productivity and the competitivity of our product. Aside from direct losses in the livestock sector, it's important to highlight the impact that this pest has on other sectors, such as agriculture, the production of feed, of balanced nutrition food, as well as the distribution of veterinary products. They could see their income reduced as the number of livestock heads and production decreased. The poultry sector and the pork sector also face challenges. Many of the principles and resources used to combat the screwworm pest can deviate resources that could be used in other aspects of animal health in these other industries. In addition, the pressure on the cost of the resources impacts all of the livestock farming chain, which could lead to a level of disruption in rural economy. The fight against the screwworm flies requires the joint effort of governments, scientists, veterinaries, and livestock farmers, as well as the associations. I need to highlight the marvelous participation of FECALAC and AULAC, and as Alejandra said, we may continue with future work throughout the period of this project. I also want to highlight the role of international organizations, AICA, OIRSA, FAO, and government agencies from other countries, such as USDA, APHIS, who have contributed with the funds to carry out these efforts regionally. Only through the implementation of sustainable programs for control, education, and new technologies may we mitigate the impacts of this pest and protect animal welfare, food security, and the economic stability of all of the livestock farming sectors. We hope that the information shared with you today has provided you with the necessary tools to face this challenge in a more efficient manner. Together, we may ensure a more prosperous future for livestock farming, for the industries, and the rural communities of Central America. Thank you very much, and let's keep working for a stronger livestock farming, more sustainable and healthier sector. Thank you. Thank you, Rocio, for these closing remarks. We must thank you all for participating. First of all, we must also thank Engineer Calderon and Dr. Garcia for joining us from Senacica, our leading authority for veterinary services in Mexico. We also want to thank the important cooperation of AICA, Rocio, Alejandra, Diego Montenegro, also Dr. Ordaz for joining us. I wanted to thank the participation of FECALAC through Wilmer and of course OIRSA, who today provided us a great talk on the situation in Central America and the cooperation of the people from USDA. I want to thank you all for your participation. Hopefully you can join us in an upcoming webinar. We wanted to remind you that we will send you a satisfaction survey, so provide your feedback to figure out so that we can improve on the future training activities on these topics. We want to invite you to the upcoming webinars on this, and we also will be sending out to your email addresses the presentations as well as access to the recording so that you can share this with other people or watch it again. Thank you all very much. I hope you have a great day, and thank you for joining us. Goodbye.
Hasta luego, gracias.
Gracias.
Goodbye, thank you.